Hello, we Team 3 are delighted to present our solution to UNICEF's brief on harnessing behavioral science to increase the uptake of HPV vaccines among adolescent girls. In the following slides, we will introduce our target audience, context, behavioral barriers, intervention, and subsequent evaluation. Our target outcome is to decrease cervical cancer incidence in women aged 30 and above by increasing provision of the vaccine. Despite the difficulty of tackling structural issues such as the global vaccine shortages, we can achieve large-scale impact through behavioral change of targeted populations. Globally, HPV vaccine uptake is lowest in sub-Saharan Africa, with 29%. To implement a region-wide intervention, we're proposing a pilot study in South Africa, given the country's struggling efforts of integrating HPV programs in public primary schools. Since the launch of the Integrated School Health Program in 2014, vaccine coverage has declined, which led to municipal relaunch campaigns from 2023. Therefore, our interventions build on such school initiatives to support vaccine uptake. Based on the COM-B framework and empirical evidence, we analyzed the behavioral barriers faced by parents and caregivers of 9 to 14-year-old girls who are the target age for HPV vaccines. These barriers to uptake encompass capability, opportunity, and motivation. Psychological capability is hindered by low health literacy and misinformation about HPV vaccines. Limited opportunity is due to restricted access to reliable information about vaccine safety, efficacy, impacts on behavior, and low physical accessibility of vaccinations. Lastly, reflective motivations such as parents' misconceptions about HPV vaccine safety also contributes to parental hesitancy in giving vaccine consent. Considering these barriers, our intervention comprised 3 elements: establishing community champions and distributing a video and a game on HPV vaccination. It will be launched during Cervical Cancer Awareness Month in January and will last 3 to 5 years, based on the length of similar community leader interventions. Our intervention supports South African municipalities' annual HPV campaigns. We propose community leaders because evidence shows these are effective in improving health outcomes. Community champions should be intrinsically motivated volunteers with personal experience related to HPV vaccination, who will receive UNICEF training and check-ins. They contribute to weekly sessions around the community, such as church-related activities, since more than 85% of the South African population is religious. The leaders combat misinformation and direct parents to vaccine resources in schools. As trusted authority figures, the champions combat communities' confirmation bias about the vaccine. This video builds support for the vaccine using value-based strategic communication. It communicates in images, evokes emotion with intention, and creates meaningful calls to action. It harnesses Schwartz theory, capturing values at the individual and cultural level. It leads with shared values to appeal, introduces the problem, and lastly, actionable solutions. The video will be shared with a target audience by community leaders during the weekly sessions. The game guides users from learning about the HPV vaccine through to receiving it, using a choose-your-own-adventure format. Users explore various choice paths, gaining information about the vaccine and its benefits, as well as the risks of not being vaccinated. The game will also be distributed by community leaders. Users engage in scenarios such as speaking to a doctor about the vaccine. They select statements reflecting their beliefs, receiving tailored responses that confront misinformation. Our intervention addresses the identified behavioral barriers by utilizing community champions to provide reliable information and support, improve physical access to vaccinations, and counter misinformation. The video and game target false beliefs about the HPV vaccine. Our intervention aligns with the PEACE framework, for example, by being affordable. It utilizes volunteer community champions and low-cost media production. Practical, by integrating into beneficiaries' routines without requiring structural changes, and equitable, by targeting parents of both school-attending and unenrolled girls although there is more outreach to church-going families. To demonstrate our intervention's efficacy, we will randomize areas to employ community champions, the video and/or the game. This enables pre-post comparison of the intervention using a mixed methods approach. The outcomes will include vaccine uptake, health literacy, and attitudes towards HPV vaccines. While our focus now has been on South Africa, our 3-pronged intervention could easily be adapted to other sub-Saharan countries by contextualizing the values and language used in the video and game. We are hopeful that our intervention can make a difference. Thank you.